Hello, everyone. I'm Bryant Mendoza with Advanced Medical Integration. Today, I have the pleasure of speaking with Dr. Steve Lipschutz from Rockville, Maryland. Great to have you here today, Dr. Steve.
Thanks for having me.
So I just wanted to take a few minutes to ask you some questions and get some feedback regarding our DME program that you implemented. First of all, why did you implement AMI's DME program?
I was actually, we were closed at the time actually due to COVID, and we were looking for something that we could do to help our patients while we weren't in the office and able to physically see them. So that was the main reason that we got started with it.
Understood. And how long did it take you to successfully implement the program?
We were up and running in just a few days from the time that we called AMI and spoke with the DME coach to get the training and get going was about 3 days total.
Wow, that's awesome. It definitely helped that you are a very quick learner. So what percentage of your patient base would you say did qualify for the program?
People are still qualifying for the program. While we were closed, we were probably able to contact at least 20% of our patients that qualified and had terrific coverage for it, and they were all in. They loved it.
Awesome. Now, what would you say are some of the benefits that your patients have experienced from utilizing DME?
Our patients, for the most part, have been complaining about working from home. They've been complaining about their makeshift workstations from their bed, from their sofa, from their stools at their kitchen counter, and to a person, everybody's been complaining about lower back pain, their posture, and then pain, going all the way up to their upper back and neck. So the lumbosacral orthoses have been great for helping people with their posture and give them the support, especially that they're not getting while they're working from home.
Now that I can relate to. Did you find the coaching on the DME program useful in implementing the program?
Yeah, the coaching was terrific. I had no idea that we were able to prescribe and utilize braces like this in our practice. So it was extremely enlightening for me, and they held our hand every step of the way from the coaching from AMI to the training that we got from Azon Medical. It was just terrific.
Okay, so the bottom line, did you receive all the help that you needed from AMI to integrate the DME program?
Absolutely. Literally from start to finish. Any question that we had, any question that a patient had, any materials that we needed, billing procedures, protocols for using the DME, it was all there. Anything and everything that we needed, it was right at our fingertips. And the coaches were available instantaneously. When we had a question, I was hearing back just minutes later and had my answer in hand.
Okay, so would you say that this program met your expectations, and why?
The program actually exceeded my expectations. We were looking for a way to survive while we were closed, and not only were we able to survive, we were actually able to thrive while we were closed. So it far exceeded my expectations, and quite frankly, because of that, I became a full AMI customer. This was kind of the lead into the full AMI program for me, which we joined right away.
That's great. I know it was definitely helpful in making that transition over to our full program. Now, Dr. Steve, I wanted to ask you, what would you say to a doctor that's currently like on the fence, thinking about implementing the AMI, DME program, but is just not sure? What would you say to a doctor like that?
I would say do it. Don't hesitate, just do it. It is a great supplement for the practice. Our patients need it and are thanking us for prescribing the braces. They're coming back and telling us how great they feel and how quickly it helped them. There should be no hesitation. I wish, my patients always say, oh, I wish I had come in, 5 years ago. I wish I had started this earlier. I wish I had started doing the DME a long time ago.
Okay. Well, Dr. Steve, I wanted to thank you on behalf of AMI for taking the time to just share your experience with our program. I'm very happy to hear you've done so well. And once again, thank you.
You're very welcome. Thank you.